Hi everybody, I'm here today to teach you about hemophilia, which is a disorder in which there is a defective coagulation factor in the body due to an X-linked recessive trait. This disease is separated into two different categories, and the symptoms may range from mild to severe. Hemophilia A, also known as classic hemophilia, is characterized by a factor 8 deficiency, while hemophilia B, also called Christmas disease, is characterized by a factor 9 deficiency. Because hemophilia is a genetic disorder, those at the highest risk for having it are those who have family members with the disorder. Both hemophilia A and B are inherited in an X-linked recessive pattern, and the genes correlated with this condition are found on the X chromosome. Since males only have one X chromosome, a single modified copy of the gene in each cell is enough to cause the disorder. This means males are much more likely to inherit hemophilia, since females have two X chromosomes. For a female to inherit it, she would have to have a father with hemophilia and a mother who is a carrier, resulting in an alteration in the gene of both copies, which is very rare. If a female does not or does have one mutated copy of the gene, she is still a carrier of hemophilia and may pass it on to her offspring. These female carriers impart the genetic defect on to 50% of their sons, and 50% of their daughters will become carriers. Due to the X-linked inheritance, males are unable to pass this disease on to their sons. However, all of their daughters will become carriers. There is another very rare form of hemophilia, known as acquired hemophilia, because it is not inherited by genetic mutations. This condition manifests usually in adulthood, with abnormal bleeding in the skin, in the muscles, and in other soft tissues, resulting from the body creating specific proteins known as antibodies, which attack and deactivate the coagulation factor 8. This form of hemophilia has been associated with some conditions, such as immune system disorders, pregnancy, cancer, and even some allergic reactions to medications. However, in over half of these cases, the cause remains unknown.
Hello everyone, I am here to talk to you about the pathophysiology of hemophilia. But before we get started, I want to do a refresher on the coagulation cascade. When the vascular endothelium is damaged, it triggers the coagulation cascade to prevent any further bleeding. Within this cascade, there are 12 different factors, which all play an important role in the converting of substances to create a clot. There is an intrinsic pathway and the extrinsic pathway. The intrinsic pathway is activated by collagen fibers coming into contact with the basement membrane and the activation of platelets. The extrinsic pathway is activated by tissue factors being released by damaged endothelial cells. These pathways then trigger the activation of the common pathway, which consists of a cascade of events to form an activated factor X, which will lead to the formation of active thrombin. Thrombin then does the final step of converting fibrinogen to fibrin, which forms the platelet plug. The forming of the clot needs to have enough reactions to produce adequate amounts of fibrin to maintain homeostasis. Hemophilia A involves a factor 8 deficiency, known as the antihemophilic factor. It is classified as fibrinogen factor and is part of the intrinsic pathway. This factor is produced by endothelial cells and provides enhancement and synthesis of thrombin, clotting factors, and fibrin formation. Hemophilia B is characterized by a factor 9 deficiency It is a vitamin K dependent factor produced by the liver by hepatocytes and also part of the intrinsic pathway. Factor 9 plays the role of serine protease, and its function is to cleave and activate factor X, which initiates the common pathway. Bleeding with hemophilia results from defective fibrin stabilization secondary to inadequate fibrin generation, which results in failure of secondary hemostasis.
Hello everyone, this is Alice, and in this presentation, I'm going to be discussing about the clinical manifestations and testing for hemophilia. Clinical manifestations of hemophilia are primarily related to bleeding. Extensive and continuous bleeding can be life-threatening to the patient because it could lead to hypovolemic shock. The clinical manifestations are persistent or prolonged bleeding from minor trauma, delayed bleeding from minor injuries and small cuts, uncontrollable hemorrhage from gingival irritation, epistaxis, hematorosis, bleeding off the GI, hematuria and potential kidney failure, ecchymosis and hematoma, and neurologic complications. An individual with hemophilia suffering from a minor injury such as cut or laceration will have difficulty stopping the bleeding on his own, so he might need a tourniquet or stitches to stop the bleeding and promote clotting. Bleeding of the mouth from a dental procedure and irritation of the gums due to the use of a hard-bristled toothbrush also prolong the bleeding episodes, so vigilant monitoring and prompt interventions are imperative. Any trauma to the nose must be avoided if possible because stopping the nosebleed or epistaxis would be difficult. GI bleeding from the peptic ulcer disease and gastritis is one of the primary causes of internal bleeding that can be evident in the stool of the patient. The stool becomes black and tarry due to the bleeding of the stomach or small intestines. Hemophilia can also lead to the presence of blood in the urine or hematuria due to possible kidney failure. The presence of blood cells in the urine indicates that the filtration slit of the kidney is not working properly, so the blood cells are excreted from the body. Ecchymosis or bruising can be painful, and it changes the normal skin color into dark purple due to internal bleeding. However, a hematoma is an accumulation of clotted or partially clotted blood in a tissue or organ due to a broken blood vessel. The buildup of the blood in the area damages the muscles, tissues, and organs due to decreased blood flow and perfusion. Pain, anesthesia, and paralysis are neurologic symptoms that stem from nerve compression due to the presence of hematoma. The compression of the nerve impedes the delivery of the sensory information from the sensory receptors to the brain, as well as it limits the ability of the brain to send orders to the organs and glands. Bleeding into the joints or hematorosis can cause deformity and severe damage to the joint by immobilizing the knees, elbows, ankle, hips, and shoulders. Screening tests for hemophilia include CBC, ABTT, prothrombin time, and fibrinogen tests. Patients with severe and prolonged bleeding will have a low RBC count. The ABTT or PT is prolonged due to the deficiency of the clotting factors. If the ABTT or PT is abnormal, fibrinogen tests must be done to the patient to check their clotting ability. I hope you guys learned from this video, and thank you for listening. Bye-bye.
Hello everyone, my name is Brianna, and I will be talking about the treatment of hemophilia. Treatment of hemophilia can be done in many ways, but the one used the most is to replace the missing blood clotting factor by infusions or injections. Replacing this clotting factor allows the blood to clot properly. These factor concentrates are injected directly into the patient's veins. They come in two different variants. Those variants are prophylactic and episodic. Prophylactic treatment is used to prevent the episodes of bleeding from happening. The episodic treatment is used to stop the bleeding as soon as it begins. If the coagulation factors are not given, then patients can bleed to death. These types of injections were originally only able to be given at treatment centers with help from specialists such as hematologists, nurses, physical therapists, social workers, and other healthcare professionals that specialize in blood treatment. Now the medical field has made it accessible to give these injections to patients at home, which allows for patients to receive help faster than if they had to wait to get to the hospital. This allows patients to not bleed to death. There are two main clotting factor types that are given to hemophilia patients. These are plasma-derived factors and recombinant factors. The plasma-derived factors come from donor's blood. It is then freeze-dried and treated for any viruses that are found in the blood before being packaged and sent to a facility for use. Recombinant factors can be made from human donors, or they may be commercially made. In 1992, the U.S. Food and Drug Administration, FDA, approved recombinant factor VIII concentrate, which does not come from human plasma. This concentrate is made by genetically engineering plasma using DNA technology. The downside of using this clotting factor is that patients may develop an inhibitor that can cause it to be more difficult for the blood to clot again. Another example of a medication that can be given to patients with hemophilia is Amicar. This medication can be given IV or by mouth. This medication is usually used to prevent clots from being broken down once they form after a dental procedure like a tooth removal, because it blocks the substance in the saliva that breaks down clots. This medication also results in a harder clot being formed since it cannot be broken down.
Hello everyone, this is Jessica and I am going to be talking to you about the nursing interventions that we use for patients with hemophilia. The nursing interventions for hemophilia are primarily focused on controlling bleeding, controlling pain, and patient education. For acute care settings, this includes stopping topical bleeding, administering anticoagulants, administering replacement factors for joint bleeding, and managing life-threatening complications that may be a result of hemorrhaging. For topical bleeding, the nurse will want to apply direct pressure and/or ice and apply a topical hemostatic agent like thrombin. When administering an anticoagulant, the nurse will want to monitor the patient for adverse reactions. If joint bleeding occurs, the nurse will want to ensure that the patient is resting the joint. Since patients with hemophilia are at risk for hematoma, swelling, and bruising, the patient may need pain management. Analgesics will be provided to the patient as needed for pain. The nurse will also want to avoid aspirin medications as this could worsen the bleeding. Elevating limbs and providing ice packs for the patient can also help to decrease the patient's pain. The nurse should be checking the patient's pain throughout the day using a reliable pain tool such as the numeric pain rating scale. For home care, the primary goal is patient education. The patient needs to be educated about hemophilia and which problems can be treated at home and which problems require the patient to seek medical attention. The problems that could require hospitalization are pain or swelling of a joint that causes loss of sleep or restricts the movement of that joint, swelling in the patient's mouth or swelling of the neck, any abdominal pain the patient experiences, and skin wounds that require stitches. The patient also needs to be educated on proper oral hygiene without causing trauma, such as using a soft bristle toothbrush. The patient should avoid contact sports to prevent injury, and also wear gloves when performing chores around the house to avoid receiving cuts from sharp objects. The patient should also be instructed to wear a medical alert tag so medical professionals are aware of the patient's hemophilia in the case of a medical emergency. If the patient received factor replacement therapy, ensure they are educated on how to self-administer the medication and also utilize the teach-back method so that way you know the patient is capable of being able to self-administer that medication. Remember that for patients with hemophilia, early detection of symptoms, pain management, and education are key for our patient care. All right, everyone, here is our first NCLEX question. A nurse is caring for a patient with hemophilia. Which concerns would be expected to be on the care plan? Select all that apply. A, deficit fluid volume. B, pain. C, dyspnea. D, ineffective tissue perfusion. E, clubbing of the fingers. F, anxiety. And the correct answers are A, B, D, and F.
A patient with hemophilia falls on their elbow and develops swelling and pain at the area of impact. What is the priority action in this scenario? A, apply heat to the limb and lie supine. B, administer aspirin to reduce the inflammation. C, apply ice and elevate the injured limb. Or D, elevate the head of the bed and wrap the limb in a bandage. The correct answer is C, apply ice and elevate the injured limb to reduce bleeding.
What is a clinical manifestation the nurse would expect to see in a patient with hemophilia A? A, petechia. B, epistaxis. C, intermittent claudication. Or D, subcutaneous emphysema. The correct answer is B.